Let's talk to Dr. Layla McCay, who's director at the NHS Confederation. Good morning to you, Layla.
Good morning.
What is going wrong with the test and trace system? You get someone who's tested positive, and you ask them for all their close contacts, and presumably a lot of the time, if it's colleagues or family members or friends, they know the numbers for those people, they know the addresses. Why is it so difficult for anyone to track these people down?
It's a great question, and it's a question that we're looking for answers for as well, to be honest. I think that there are lots of different steps within the test and trace system, and it feels like they're dropping off in each of those different steps. So even contacting the people who have tested positive, they're getting less than 80% of all the people who are testing positive. They're even managing to contact at all. Of those, only a certain number are providing their contacts, and we don't know how many of the total contacts the ones they provide actually cover. And then of the ones that they've provided, then there's this challenge that they're not getting a hold of all of them. And the fact that these percentages of people contacted are actually going down, I think, is really worrying for all of us.
It's not just worrying, it's totally unacceptable. I don't understand. The first point, it starts going wrong with only 80% of people who are testing positive being contacted. If you have gone for a free COVID test at an NHS facility to get that test, you had them sent at home, surely, but we've got your name, you've booked it, you've had to book it online, or you've gone and got one and delivered to your home. We've got your name, we've got your address, surely we've got your mobile number as well. The idea that we can't track those people down. My 13-year-old could track those people down. Why can't the government do it?
We really need to know the answer to that question. And I think that one of the things that we're seeing as the percentages of successful tracking are going down, what we're seeing is there's two different folks who are looking after the tracking. There's the Public Health England and local authorities who are tracking the more complex cases or clusters of cases if they happen like in a school or a jail or something. But then there's the larger 24,000 or so people who are working on more general tracking. And what we've been seeing this week is that there's been fewer complex cases, and actually those people who, of course, have lots of years of training in doing this have been significantly more effective at getting all the people compared to the larger and newer trained people. So yeah. I think that as we see the different trends in the virus, we're probably going to see these fluctuations, but it's not okay because. No. The fewer people are traced, the bigger the risk is of this going up.
Exactly. There is this issue, isn't there? People who they don't want to be traced, they don't want to be identified. They'll perhaps think, I'm going to be extra careful. I won't go near my elderly parents or go out to the supermarket. But I'm a bit worried about that. But I don't want the officials to know that I need to quarantine for 2 weeks because I need to work. And this is the concern about people not getting paid and also passing on contact details of people who also would be worrying about getting paid. And again, a lot of these decisions, a lot of these rules are made by people who are public servants, who do the best will in the world, don't understand the concept of not getting paid when you don't go to work.
That's right. There's lots of different incentives that affect how people behave, whether they choose to go out, choose to wear a mask, choose to wash their hands, choose to get involved in the contact tracing. These are all human decisions, and all sorts of different factors go into those. And while this is really, really important, I think that we have to understand those reasons and help to reduce the barriers so that more people are keen to participate. And I think that we also need to realise that the contact tracing system is only as good as people who know their contacts. We still don't have a functioning app that will tell us if we've been in contact with strangers who have got the disease.
Yeah, indeed. This is the thing. Is local testing and tracing, is that much better? We know that in places like Leicester, they complained that they didn't get a lot of the information soon enough. And we know that some other areas, Aberdeen and others that are going into sort of versions of local lockdowns, that they are saying, actually, we need to use, and Greater Manchester, we need to use local tracing people because they're using local knowledge and they're doing a lot better job and tracking down a lot more people.
That's what we're hearing too. Essentially, when things are happening at a local level, they have that local expertise. They know their local populations and their local geographies, and they're able to really make that detailed analysis. And I think for a while it was a real challenge for the local experts to be getting the data coming from the national tracing system. It sounds like that is improving a bit, and that is another key to keeping this virus under control.
Yeah, absolutely. Dr. Layla McCay, thanks for taking the time to talk to us, Director at the NHS Confederation.